So, what are the latest treatments for diabetes, or what's in the pipeline and what's coming? So, since the innovation or the advent of the GLP-1 and the GIP medications have really come and leapt into the forefront of treatment of diabetes and become the first line treatment, they're really good at curbing your appetite and having you behave and not eat large meals and keep your cravings for carbohydrates down. But again, does anybody want to take medications for the rest of their life? And what's coming? We know that there are new GIP-1s and GLP-1s and combination medications that work on your metabolic rate. By increasing your metabolic rate and your caloric burn, while increasing your insulin levels, you're able to burn fat, have less cravings, and really target what the causes of diabetes. And they're becoming more potent medications out there. But what else is out there? So there's a novel company that is working on gene therapy where they use what's called a viral vector or a virus to change your genes. I know it sounds a little bit movie-like, and we've all seen when we mess around with our genetic codes what bad things can happen. But this is next generation stuff. And where basically they take the virus and they inject it under endoscopic ultrasound. So it's endoscopy with an ultrasound at the end of it, where we look at the pancreas, and we do a lot of these exams today. And we take a needle and we inject these viral vectors or these genes into your pancreas. And what do we see? We see that within a week, your natural GLP-1 levels and insulin levels go up, which means we're pretty much curing diabetes with an injection of a needle. And what we're seeing, at least in early animal models and studies, is that this only has to be done once, and this can really change the course of diabetes and how it's treated. Currently, there's an active clinical trial going on in Australia and Europe where they're getting very, very, very good, favorable results. And we look forward for that data to come out and for this treatment to hit America. And that should happen in the next 2 years. And we could be looking at an endoscopic cure for diabetes, which can really change the course for how we treat the metabolic syndrome.